work on cervical stability. This includes the deep neck muscles in the front of the neck. And so we're going to go onto our hands and our knees. So I'm going to go down here. So you should be able to keep a long line from the top of your head down to through your tailbone here. This is just already stabilizing because you're keeping your head from falling down. So you want to really focus on the back of the neck, reaching up towards that ceiling rather than letting your head jut forward. Now, once you're there, can you rotate and look one side and keep your head along the same axis? And then rotate the other way, keep your head along the same axis. So what I'm seeing with some people already is I'm getting this. I'm going to exaggerate a little so it's a little easier to see. There's a rotation through here, and if you look at my neck closely, my chin is jutting forward and I'm extending through my neck. So then there you've lost your stability of your deep neck flexors and you're crunching into the back of your neck. So you want to keep a bit of a chin tuck, which is like retracting your head back, and spin along that line, keeping the chin down rather than letting it jut forward. We're not always on all fours, and we really use our arms, and our arms often are overhead, yes? So stabilize through here, and you're going to reach one arm up and overhead, and you're going to try to make it through the same plane of the rest of your body. And then I want you to think you're looking a little bit down, so I'm going to have you exactly. So then you have the length through here, and then the deep neck flexor. So you feel that? Good. Now maintain that, and now I want you to reach a little bit more again overhead, one arm. Good, that's better. And back down. It looks like it's a little stiff once you get near the top, yes? What does it feel like it makes you want to do when you reach overhead?
Like bending in half.
Huh?
Like bending my stomach in half.
Bending your stomach in half. So he's saying when he reaches up forward, he kind of wants to hunch a little bit in order to get that arm a little bit higher. So that's partly going to include the thoracic mobility, but part of it too is if you can't hold this, you end up doing this to get the arm up. It does feel relatively up. Your arm is by your ear when you do that. But are you in line still when you do this? And am I getting full shoulder flexion when I get this? So then if I try to do a handstand when I'm in this plane with my chin forward and my arm overhead, where's the rest of my body and how is it going to stack over my body? Does that make sense?